Right, good evening, ladies and gentlemen, and welcome to the Adult Health and Social Care Scrutiny Board on Thursday, the 17th of September 2020 on this really sunny evening. First of all, thank you, Carol. We've had a few technical problems this evening, but she's managed to get us there. So thank you, Carol, once again. We're there. So we are now live on streaming. So let's get on with the agenda so we can catch up a little bit of time, hopefully. So substitutes nominated for this meeting and apologies for absence. We seem to have a full team tonight. Is that the case, Carol? Yeah,
as far as I'm aware, I've had no apologies. Thank you.
Fabulous. Okay, item number 2, members interested to remind members to declare their interest at the relevant times. Admissions, item number 3, admissions of the public. It is not recommended that the public be excluded from the meeting, so you're all welcome, anyone who's joining us on YouTube, and I hope you enjoy the contents of this meeting. Minutes of the Adult Health and Social Care Scrutiny Board held on the 20th of August 2020. They have been circulated. Carol, would you like to come in? I think there's an item in relation to Councillor Greenwood, who was at a meeting. So would you like to just clarify that, please?
Yes, my apologies, Chair. Councillor Greenwood was accidentally omitted from the 16th of July minutes, so I just need to correct those minutes if everyone's in agreement.
Yeah, absolutely. Yeah, most definitely. Can I have someone in to move the minutes of the 20th of August minutes? Yeah, thank you, Councillor Whittaker, and Councillor Barnes for seconding. So thank you for that. So item number 5 in that case. So our regular COVID briefing. So Debs, would you like to start off, please? Welcome to the meeting, by the way.
Thank you, everybody. Yeah, I'm sorry that I'm not going to be giving you good news today, unfortunately. I think you the first thing I'll start with is you recall we tend to use something called the 7-day infection rate, and it's the rate of cases over an average of 7 days per 100,000 population, and it's based on the date that the tests were carried out. It's the most robust indicator that we've got. And in the 7 days prior to the 11th of September, the rate was 62.8. Wow. So that is the highest rate that we've had in Calderdale since we started getting the data from both pillars of testing. I think if you remember at the beginning of the pandemic, when I was giving updates, I was saying that we were only getting testing data on test through pillar 1. Now, this doesn't mean that I think the situation is worse than it was in April. I think because obviously we can't compare the rate now with the rate in April because we just weren't getting the data. But this is a rise from about 42 in the previous week. And as I say, this is the highest rate we've seen in Calderdale since we started getting data, the whole local data. We are ranked at 35th highest in the country in terms of that rate. So there are quite a number of local authorities that have got much higher rates actually than us. And you'll recall, I think we were 5th in the country at one point. This is not because we're getting better, unfortunately. It's because the rates in other areas are increasing so quickly. And also, just to say that the other indicator that we use is we look at what percentage of the people that are tested test positive, and actually that's increasing as well. So that's a real indicator that the cases are going up. So it's about 5.5% now of Calderdale residents that test positive, that are tested test positive. I'm going to come on to testing because I do want to sort of give a bit of an update on testing, but this is the sort of situation that we're in now. I thought it would be useful, Chair, to just sort of reflect a little bit about what's happening and perhaps why it's happening and what we do and what we don't know. So the data is telling us that rates are rising in almost all parts of the borough. Right across the borough, whereas I think previously we've seen our high rates concentrated in particular areas. You know, that is no longer the case. We're seeing, you know, high levels of cases right across the borough. We're also seeing some changes in the age and ethnicity of the people that are testing positive. So it's now, you know, around 70 to 75% of the people that are testing positive are of white ethnicity, whereas previously, a month, 6 weeks ago, we were seeing a similar proportion of people that are of Asian ethnicity. And we're now seeing that it's really working age people, and that's a pattern we've been seeing for a while, that working age people are the largest group. What we have seen actually over the sort of last month while we've had the increase is that initially it was in the younger end, so the sort of 18 to 34 age group. We're now seeing the sort of 34 to 64 years age group, and I think members of the board might be aware that there's a pattern around a gradual ageing of the cohort of people that seem to be being affected. And of course, this is a real concern to us, because we've got very low levels at the moment of people that are aged over 65 and over being affected, a very small percentage, sort of 5% or something like that. And obviously what we really don't want to happen is older people to you know, a higher rate of infection in older people. And what's also, the data's also telling us, is that most cases at the moment don't appear to be part of a cluster of cases in a household, in a workplace, or in another setting. So it seems that there are cases right across the borough, and we don't always understand where that transmission is happening. If we think about why the rate of cases is increasing, we know that there's an increase in cases nationally in the last week to 10 days. There's been, since the beginning of September, there's been a very rapid increase right across the whole country. And we don't know all the reasons why this is happening. We know that where we are having success in Calderdale, and we are still having some success in parts of the borough, we know that that's where we've been engaging very intensively with communities. And we know what communities are telling us. And they're telling us that they're confused about some of the rules and the restrictions. They're telling us that they're tired and they're frustrated because they feel the rules are unfair or inconsistent, and they're difficult to understand. We've also, as I said, seen an increase right across the country at the end of the holiday period, and this may indicate that travellers have an impact, but we don't really understand fully if that's the case yet. And I think what I'd also say is that we know that in parts of West Yorkshire and neighbouring areas to the south and to the west of us, that there are very high rates, and that we know, don't we, that people travel between those areas to work, to education. What we are doing in Calderdale is we're working really hard to understand the local picture in more detail. We're lucky actually to have a fantastic team of local contact tracers, and they're using local knowledge to get extra insight into how transmission's happening in the borough that we can't get, no fault of the National Test and Trace system, but they don't have that sort of local knowledge. So we are able to, that is going to help us really understand very specific information about where transmission might be happening. So, for example, we've seen some transmission that seems to be linked to potentially grassroots sports or sports clubs, as an example. You know, I'm not saying that's a major issue, but it's an example of where local insight is giving us some additional information that we would get from national information. So I just want to say a little bit briefly about schools and about care homes very briefly, and I'll pick up in more detail a little bit about contact tracing, and then a little bit about testing, if that's okay. So just to let you know that obviously with schools returning, we have had a small number of cases in schools. We haven't got any outbreaks in schools, which is fantastic yet. So just wanted to let you know, as you know, there's really strong COVID secure approaches in our schools who are working incredibly hard, and we've had cases in 2 early years settings, 3 primary schools and 2 secondary schools, and in all of those cases, you know, either a year or a bubble has gone home and is isolating, which is exactly what should happen. And we've currently got 4 outbreaks in care homes, and the people affected there are mainly staff rather than residents in the main. We are having a large number of issues with testing, unfortunately, and it's again a national issue. The demand for tests is outstripping the ability of laboratories to process those tests. And obviously, because if a test has to be processed within a certain amount of time, and what that means is that rather than people being tested and then the lab not processing them in time, because it would give a higher likelihood of an invalid result, we're actually limiting the amount of testing that's happening. When I say we, I don't mean us in Calderdale, but the system is limiting the testing, which is absolutely understandable. And there's a number of reasons why this is happening. There are the return from holiday. There are people, there's been demand for testing. There's people not wanting to quarantine on return from holiday or being tested on return from holiday. And we do know that children returning to school and with some symptoms, you know, that the symptoms of COVID can be quite generic and perhaps sniffles, and people are looking to get tested there as well. But you know, we've got to be honest, the increase in transmission, the increase in infection means that there'll be higher demand for testing as well. And just I think what's really important to say is that at the moment it's really important, if we're going to sort of ensure that we try and bring this increase back under control and contain further increases, that if we have symptoms, we do isolate for 10 days and do try and get a test. And we are actually saying to people, please don't get a test if you're not, if you're looking to get a test for reassurance or you know, if you haven't got symptoms, please don't get a test. We only will now want people to get a test, you know, try and book a test if they've got symptoms. And what we want, so that the people that can benefit most really, you know, are getting those tests. But if people are struggling to get a test and they have symptoms, it's really important that they stay at home. It's really important that people get a test within 5 days of symptoms. And if they're unable to get a test within 5 days of symptoms, I'd say 2 things. Still self-isolate for the full 10 days. And secondly, keep trying. Keep trying to book a test online. Test slots become available throughout the day. Those people that I've heard from that are persevering, some of them are managing to get a test. So I would encourage everybody to keep trying. This is really important because getting the test, getting a positive test, getting contacted by NHS test and trace or by our local contact tracers, and identifying the people that have been exposed to the virus and separating the people that have been exposed to the virus from everybody else is one of the most important ways we're going to be able to contain the virus. And unfortunately, in relation to our local contact tracing service, which I shouldn't have started with unfortunately because it's brilliant, and we're managing to reach almost everybody that comes our way through the local contact tracing, and actually where those that we aren't reaching, there's usually a really good reason. We've got the wrong details, or they're in hospital, or there's a good reason. So, but I think what the reason I was saying, unfortunately, is obviously the longer it takes for someone to get a test, the longer it takes for the test to be analysed and then to get the results of the test, and then the longer then it takes for us to either get contacted by test and trace or our own contact tracers. You know, the longer that period of time, the more the risk of onward transmission is. So it's really, you know, it is a real concern. And one of the concerns, I've just got an alert on my phone that's showing that only around 33% of tests actually people are getting the results within 24 hours at the moment. So this is a concern, and I do know that the government are working incredibly hard to you know, get the testing system working and get increased capacity. But I think we all have a part to play as well by really only going for a test if we've got symptoms. I think it needs to be a partnership between us as citizens and the government, and we all need to work equally hard on that. So I'm gonna stop there in case there's any questions. I don't know if Ian wants to come in on the care sector further.
I'm going to bring some questions. Thank you, Debs, for giving us a bit of a gloomy update. And I guess there's going to be further announcements, whatever those are. So you might be able to explain what that actually means for residents of Calderdale. So I'm going to bring Councillor Whittaker in first, please.
Thank you, Chair. Debs, first of all, thank you for your ongoing efforts. I know that there is fatigue all round, really, and I can't imagine how you and your team are feeling when you're dealing with it day in and day out. So well done, and thank you first of all. Can I just clarify just on the spread of the increase across Calderdale? Is it the case that it is going up proportionately and equally across all areas of Calderdale? And if so, are you suggesting, or would indeed you recommend, that Calder Valley go back into local restrictions as Halifax still are, or conversely that Halifax should come out to adhere to the national guidelines along with Calder Valley?
I think we are seeing increases right across the borough. We are seeing there's a small number of wards that are decreasing, and we are seeing some big increases in some areas, right across the borough, both areas where we've got local restrictions currently and areas without them. We're not seeing a pattern that can be explained by the local restrictions. So I think it's difficult for the recommendation. My view, my personal professional view, is actually that the action that we're taking locally is having more of an impact than the restrictions. That's what the evidence would indicate to me. Because the areas where we're seeing the biggest decreases are the areas where we've been doing the community engagement, where we've been working in a really focused and coordinated way with communities, where we've been doing our local contact tracing, where we've been really making testing easier to access. They're the areas that are consistently showing a reduction, and then none of those things are linked in a way to the household restrictions, if that makes sense, those actions. Obviously, there's a process that happens every week where the local political leaders come together, make a recommendation. That recommendation goes into a national process, and we expect to get an announcement tomorrow about what the outcome of that will be. And obviously, you know, that's a really important part of the process. But as I say, my professional view is, I think at the moment the local restrictions are causing confusion, and actually the rule of six, which is the national message at the moment, the communities are telling us they understand that. It's really straightforward. It's telling us what we can do. It's a very positive message, and it seems fair and it seems consistent. So I think that would be my answer to your question, Councillor Whittaker.
Super. We've got a number of other questions, so we can keep the questions very precise, if that's okay, please. So, Councillor Lee, if you'd like to come in, please.
Thank you, Chair. First of all, could I say, Debs, how very hard you and your teams are working. We know that, and you're under such an incredible amount of pressure. So I think everybody understands that, but we still got to ask the questions. Of course we have. Very quickly, there's a couple of questions, very quickly. Can you reassure us that people in our care homes are going to be safer than first time round, and that won't happen again? Secondly, you mentioned a 5.5% infection rate on our tests. I know that last time we looked at this, it was about double the national rate. So how do we stand with that compared with what's going on nationally? And thirdly, are there any enforcement activities going on which you've found necessary since we last spoke? Thank you.
Thank you, Councillor Lee. I wondered if Ian wants to come in on the care home, answer the care home question.
Yeah, I think that more than happy to. So, Councillor Lee, I think Debs has made reference in her overall view about currently we have four outbreaks of in our care homes. And we are continually working with all our care homes, all 33 of our care homes, to make sure that where possible, we can keep them as COVID-free as possible. And where there are outbreaks, and an outbreak being defined as where there's more than one person, so i.e. 2 people with a positive test result, we're trying to then work with them as quickly as possible to ensure that people are cared for and well supported. For over a month, I think last month we reported to Scrutiny the number of deaths in care homes was a cumulative figure of 34, and that remains the same. So the big challenge here is to make sure that we can keep COVID away from homes for as long as possible. What we do have is obviously increased prevalence across the borough. And what we are seeing is starting to see more positive test results in the workforce. So again, it's really important that we work with those staff to help them self-isolate, that we work with providers to make sure that they have got sufficient cover to make sure that they're not bringing people in who are not well. One of the good a really positive announcement today from government is that the announcement that they will extend the infection control fund that was introduced in May this year, and it will run to the end of the financial year. The total announcement nationally is 546 million. And if the proportion of allocation is based on the previous round of infection control money, that would mean about 1.9 million to directly support our care homes in terms of infection control, supporting staff to stay at home and avoid staff working across a number of multiple sites, because that has been a critical issue and learning that we've learned from COVID. If we can stop people working across a number of sites, that will limit the risk. What we also know from government today is that they're intending to supply free PPE to all care providers. There's 2 channels by which that will be done. So our care homes and all our regulated CQC services will, through a national portal, will be able to order PPE and have PPE directly distributed through a national system. For our non-regulated services, and for example, that would be people who employ personal assistants directly themselves, the local authority will, on behalf of government, distribute PPE free to those providers as well. So I think what we know helps reduce the risk to our care homes, but also all our care providers, isn't just our care homes, is if we've got strong infection control procedures, there's good PPE, and people have got the ability to understand all the guidance that's important for them. So whilst I can't sit here and say that we won't have more cases in care homes, because whilst there's community prevalence, the risk is always there. But I think I do believe we've got a way of working across the system to make sure that we mitigate the risks. And certainly the new funding is most welcome. I hope that helps.
Yeah, good. Thank you for that and the explanation. Councillor Barnes, you'd like to raise a question?
Thank you, Chair. I think Councillor Lee and Councillor Whittaker summed up our thoughts on what public health are doing. So thank you for those comments to the 2 of you. I think I'd like to repeat and exactly what Debs has said about the confusion that's been messages I'm getting every week of confusion. And I think it would be better if the Calderdale was a consistent across the board, whatever that consistency is. But I think in terms of testing, I think there is some confusion in the area about what is permissible at the ASDA site, the walk-in site, And this week alone, I've had about 5 messages from people, from residents, with completely different understanding of what is available and what can be done at the Asda site. Now I have spoken to Ben, and Ben kindly gave me the rules and what have you, but I think there is some confusion out there as to what people can and can't do, and I think it might be worth having another round of communication on that. Thank you, Chair.
Thank you.
May I respond, Chair?
Please, yeah, please do. Yeah, please.
I'm conscious as well, if it's okay, Chair, that Councillor Lee asked a couple of other elements to his question before.
That's fine. If you just incorporate those, yeah, please. Yeah,
if that's all right. So just, you asked about the positivity rate nationally, and you said last time we were double. We're not quite double now, because unfortunately the positivity rate's gone up right across the country. So the positivity rate nationally is just over 3%, and we're about 5.5%. So we're not. The situation is deteriorated everywhere. In terms of enforcement action, yes, we continue to do enforcement action, very similar to previously. I understand there's a summary being shared. I don't know if it was at the full council meeting. We've asked for that. I've asked for that to be updated, so that there's we can share with you all as members, you know, the scale of the enforcement activity, often relating to night to visitor attractions, nighttime economy, etc., workplaces. We have used some licensing powers as well, and we have used some of the COVID regulations. What in the vast majority of times that we use those powers, we issue a direction and say to the establishment that it's our intention to use these powers unless we see an improvement. And in absolutely the vast majority of occasions, once we've written that letter and issued that direction, we go back and visit Councillor Lee, and there's an improvement being made. I really can see how hard our local businesses, our local workplaces are working to be COVID secure and ensure that they adhere to the guidance. So yes, I haven't got the most up-to-date figures, unfortunately, about the numbers of organisations we've taken action against, because every time I do give a figure, I'm told it's out of date because we've done another one. So I'm happy to share that after the meeting. In terms of the question from Councillor Barnes about Asda, yeah, I mean it's a real disappointment, Councillor Barnes, to us that the site at Asda. The intention of that, when we designed that as a local pilot in partnership with Department of Health and Social Care and Deloitte, was that it would have a walk-up element. It wouldn't all be booked online. It would be welcoming and accessible to the local community. Unfortunately, we found out that on Monday, because of the situation that's happened with the shortage of testing in the issue I mentioned earlier, that they are now not accepting any walk-ups at Asda, unfortunately, and all I can say is I'm really sorry about that. We weren't informed as a partner that was going to happen. We were just told it had happened rather than asked about it. What I would say to people is, though, you know, you can still book if you keep trying. If you can get on the internet and do try and use the booking portal, as I said earlier, appointments for Asda are coming up. But you just have to keep trying. So it is disappointing.
Excellent, thank you for that. Councillor Hutchinson, please.
Thank you, Chair. As you've said, in terms of actually effective contact tracing, you need to get in touch with people very shortly after they start developing symptoms. And you've said that the numbers of cases have been rising in Calderdale. But on Thursday and Friday, there were no patients referred from the national system to the local system for contact tracing. There were only 2 this morning, and a lot of them are very close to the end of their isolation period. It's taking 8-9 days before we're actually being informed of them at a local level. Now, I can understand that there are delays at the laboratories in opening the packages and processing them, but surely that can't account for all those delays and the small numbers that are being referred through. Are there no areas within the system where there are other delays that could be ironed out? And we've also, early on in the stage, eminent figures like Professor Chris Ham from the King's Fund and our own Chief Executive, Robin Tuddenham, flagged up the risks in putting all our national efforts into a very centralized system of laboratories and contact tracing. What's happening now surely shows that those fears were well founded. Is there anything we can do locally to make our system better? Is there no way in which we can have a greater amount of local testing, which could then feed into a much less restricted form of contact tracing, because we're only being allowed access to the people that the national system has failed to contact. And once we've identified their contacts, we have to return them back into the same poorly functioning system for the national system to have another go at contacting the contacts, who might be in the same house that we're standing on the very doorstep of, speaking to the person who was infected. Just one other question. If we're saying to reduce people's demands on the testing system, can you get an isolation note? Can you apply to your employer for statutory sick pay if you haven't tested positive?
Debs, if you'd like to come in on that, that'd be most helpful, yeah.
Yeah, I mean, I think these are all extremely important points that Councillor Hutchinson's making, and there is a lot we are doing that. We've as Calderdale, as part of our asks of government, have included, we want to see 24 hours to get a test, 24 hours to process it, 24 hours to get contact traced. That's what will help us. And we've actually, in our ask of government, we've actually said that. We've asked very much for, and we do understand how hard the work that's going on around testing is, and again, we have raised our concerns about the delays and right across that system. We have asked also if we can please do contact tracing for the whole borough now, rather than just the part of the borough that was initially the high incidence area, because we have high incidence everywhere now. So we've asked that question. So and also again, as we do every week when we put our proposal from political leaders into government, we've asked for support for people, financial support for people that are self-isolating, and we've actually given some examples of where the lack of that financial support has caused difficulties and potentially onward transmission. So really good points. And we are feeding exactly those points into government. I think it's a really good question, Councillor Hutchinson, about what we can do locally, and I think we'll definitely pursue that and speak to our local NHS partners about what we can do locally. So thank you for that.
Yeah, thanks, Deb. Councillor Megan Swift, would you like to unmute yourself and come in, please?
Or else I won't be able to do it. Can you hear me?
We can now, yes, indeed.
Yes,
yeah,
thank you. Sorry about that. I mean, Deb's answered an awful lot of things that I would have asked for, but we seem to have majorly two groups of people at the moment. We've got the people who are absolutely terrified that this is going to impact on the family. And then with the other group, that it won't happen, it's okay. I mean, last week after one of the government announcements, we went to the pub. That's where, and the pub, on one side of the pub, people were sat all round tables and the chairs, all next to each other, and about 3 people spread out in the rest of the pub. People, I mean, I don't want to cause a panic, but people are ignoring even now. And I mean, I find it really difficult to work out why. And my other comment is on testing. It would seem, well, they talked today, didn't they, about prioritising frontline workers and care homes. I mean, I haven't a problem with either of that. I'm just amazed it hasn't happened before, to be honest. And on these things, I'm not trying to make a political point. It's just, you know, I'm not sure how anybody knows how to deal with this to start with. But, you know, if my granddaughter was ill tomorrow, I wouldn't be happy if I couldn't find anywhere to have her tested, but I'd be even less happy if, I don't know, other people had more priority, which seems to me that these people are more important than my granddaughter. We've got to find a way, whether we can do something special with kids in school, I don't know. But
I'm good.
Sorry.
Thanks. Yeah, no, thanks, Meg. I'm going to bring in Helen Hunter's question. Helen Hunter is from Health Watch, and she's raised the following question because it sort of ties in. So I'll read it out because it's been done on the chat group so that anyone watching can see. And somebody's just moved this screen up, so just bear with me one moment. Right, the question is, what can we do to make sure that people who are most vulnerable retain access to testing? I have some concern that it could be those who are most empowered, who have the time to persist with calls, rather than those who might face communication barriers or have significant health issues that are able to get tests. So that's the question raised from Helen Hunter from Health Watch. It feels like a talking show now. So Deb, would you like to come back on that, please?
Yeah, but really good questions from both Councillor Swift and Helen. Yeah, I mean, we have a group, a Calderdale Health Protection Assurance group that provides sort of the tactical coordination of our work on our local outbreak plan. We met yesterday, and one of the actions that we've taken from that is we have a testing strategy for Calderdale, and it's a testing strategy that we wrote when testing was in massive supply. We were one of the highest testers in the country. We were testing everybody, and our whole strategy was based on the premise that anybody would be able to get tested. What's happened, obviously, and that's very much where we've been, because we've been an area of local intervention. We've been given opportunities to get additional access to testing. So what we're doing in the next couple of days is reviewing that testing strategy so that it includes what, you know, the normal strategy for normal times and the strategy for what our approach to testing will be when there's shortages of testing. And absolutely has got to be about the people that need the tests most getting them, and that it absolutely includes people that are vulnerable. It does include people with symptoms who are key workers in care, in health service and teaching roles that keep our keep us going. So absolutely, really good question. So we are reviewing that testing strategy.
Thanks, Deb, for that, and welcome, Helen, of course. Councillor Greenwood, I think I might have missed you, so my apologies, but you wanted to make it.
That's fine, Chair, thank you. Yeah, my great concern, we were lucky to go away for the last 5 days, but it was a very worrying situation. We went to the coast as a family of 5, and thinking that now that the schools were back, it would be quieter. Now, this was probably an unusual situation because people had heard what the weather forecast was going to be like. But we knew when we booked this weeks ago that the resort was absolutely full. We had a really hard time finding somewhere to stay. And where I'm so confident and encouraged from what I've heard from our executive officers today about what they're doing for Calderdale. So I'm confident for the authority where we live about how we are being supported and protected. But hundreds and hundreds of people walking along the seafront, coughing, talking, sneezing, shoulder to shoulder, and we were stuck in the middle of packs of hundreds of people. And the government have to do something else now. You can distance outside a shop, you can queue, you can put your mask on to go in the shop, who might control the distance there. But out on the streets, and especially when people are socializing and relaxing and with friends, this all goes out of the window. So nationally, we're not doing enough.
Well, I think the groupings of 6 may actually resolve that scenario where you don't get more than 6 people. You know, certainly take your points on board, Councillor Greenwood. And can I bring in Ian Baines at this stage, just to provide us with a very brief, quick overview of anything that's been missed, that's not been picked up already, please. Yeah.
I'm acutely aware of the time, Chair, so I think probably I kind of covered quite a lot in my answer to Councillor Reeve. So at this stage, I think there's probably nothing else to add.
Fabulous, thank you for that. And any questions you can email to the Members Hub anyway, so people are aware of that. So thank you for the very much steps, for the update, for the hard work that you're doing. It is very much recognised and formally recognised from this scrutiny board that actually you are doing a splendid job given the unprecedented and challenging circumstances we're facing at the moment. So yeah, absolutely, well done. So let's move on to item number 6. So Helen, welcome, Helen from Health Watch. It's really great to have you come to one of our virtual meetings. We always like to welcome you on board. We like to work with you. We think we're building up a really nice working relationship where we're hopefully helping you, you're helping us, and actually working better to help the people in the community. So the papers have been circulated. I know you're going to do a very short presentation, you know, because as you can see, time-wise, we do get quite a number of questions. So I'd like to make sure we have the opportunity for members to ask those questions. So welcome, Helen. The floor is yours for a few moments.
Thank you. I was going to say, I mean, that is a test to try and condense everything into a very quick presentation, but I will try my very best.
I'm sure you will. I'm sure you will.
I was going to share my screen, but I don't think I can. Alex, can you share the presentation for me?
Yes, yeah, just 1 second, Chair. I'll get that sorted out.
Thank you. So just in case anybody's not met me before, I am Helen Hunter. I'm the Chief Exec at Health Watch Kirklees and Health Watch Calderdale. I've worked for Health Watch for about 7 years, so I really have no excuse not to know answers to questions that people might ask me, but be kind to me anyway. So I'm going to do today a little bit of a rundown of what was in our annual report, which obviously you've received, and give you some information about the piece of engagement work that we've been doing about COVID-19, how that ties in with Calderdale involvement strategy, and to talk about what things that we could work on together. Sorry, Alex.
And apologies, Carol, it's blocking me from sharing the screen. Would you be able to do that, please? I'm not sure if it's just something the host can do.
We've been having real technical issues tonight, so bear with us.
I have allowed you permission to share now, so either of you should be able to.
Great stuff. I'm happy to share.
Fabulous. We're starting here, so there we go.
Smashing. Okay, so I've already done these bits. I did put a slide in the pack just about what Health Watch is, just in case anybody wasn't familiar with it. And I've created a list here of all of the pieces of work that are in our annual report that we completed in 2019-2020. I would say that's a huge volume of work, given that we only employ 2.2 full-time equivalent staff to work specifically on Health Watch and 1 person full-time to work on the NHS complaints advocacy. So I'm incredibly impressed with my fabulous team for all the work that they've done. I listed here the projects that we've already worked with Scrutiny on, so the wheelchair services stuff, adult autism, child and adolescent mental health, and dentistry. So I thought that what I would do is I would showcase 3 key pieces of work that you probably haven't been aware that we've been working on. So I'll start with the single point of access for mental health, which is the service about which we hear most unprompted feedback. So what I mean by that is that we often go out and ask people what they think about a particular service. With the single point of access for mental health, we were getting people actively contacting us and saying that they were disappointed with the support that they'd received. And because the service is delivered across Calderdale and Kirklees, we work together on that as a Calderdale and Kirklees team to do the piece of work. We did a survey that captured the perspectives of about 250 people who'd used that service, but that's about half service users and carers and half professionals who contact that service. And the really key thing that it told us was that people thought that that service ought to be able to offer them some emotional support in a crisis, but it's actually quite a functional referral type service. So people were expecting to get a helpline and some kind of ongoing emotional support, and they weren't able to get that. And then they felt very dismissed by the process when actually they'd spoken to somebody who they felt should have been compassionate toward them. So we've worked really closely with Swift in order to try to make a change with that service. Swift was really accepting of the fact that changes need to be made, and they've done a lot of work across the last year, both in partnership with us and sort of on their own to try and enhance the service. So we've run a couple of engagement events jointly. They've changed part of their triaging system. So actually there's now more levels that you can be assessed as being at and different timescales by which you might get seen by somebody depending upon the urgency of your need. And because there was such a strong dialogue that actually there was a need for kind of helpline type support, there's been some additional funding made available for a telephone helpline, and they are looking at how they connect the two telephone systems so that actually you'll be able to select to speak to the helpline or select to speak to the single point of access for mental health. So it kind of really helps people who might need that compassion right now, but not necessarily a referral into mental health services. And we're still doing some work with them around compassion and encouraging people with lived experience of accessing that service to be involved in the training of the people who answer the phone. So there's ongoing work there, but we feel like it's been a really positive outcome. I'm going to talk a little bit about hypermobility syndromes. So I'm not sure that even everybody on the panel would understand exactly what a hypermobility syndrome is, but it's a syndrome that affects your connective tissues, and quite often it results in people having sort of hypermobile joints and real flexibility, which can be something that's really positive. But if you suffer from one of the syndromes, actually, you will have problems potentially with digestion, with fatigue, with any symptom in your body, with your skin, all sorts of different issues. And because it's a whole body condition, actually, often you find that the NHS wants to deal with things in its component parts. People really struggle to get appropriate support. So we led a piece of work across Yorkshire and Humber to find out about people's lived experience if they had hypermobility syndrome. We found out that there was a lack of awareness of what hypermobility syndromes are amongst professionals, and that it was hard to get access to specialist care. And we've been able to, I've put a screenshot of it on the slides. We've actually created a video that's on our YouTube channel where we've got some people telling their stories of life with hypermobility, which is a really interesting thing to listen to. What we've been able to do by gathering that feedback is create a bit of momentum on a national footprint, which is fantastic. And we're now working with Healthwatch England on a national project. We've had real positive feedback from the national charities such as Ehlers Danlos UK, who support people with particular hypermobility syndrome. And we've worked with Craig Whitaker's office in order to be able to raise an adjournment debate which has put some pressure on NHS England to work with us around this. So we've had a much bigger impact than we perhaps perceived that we would do in the first instance, and it's great to be working on that larger footprint. And the last piece of work that I wanted to showcase is our work on the outpatient transformation at Calderdale and Huddersfield Trust. So the Trust approached us because they wanted to make sure that as they transformed outpatients, they weren't leaving anybody behind because of any kind of communication barrier that they might have, because of any sort of access issues that there might be. So we work with a range of different groups, as listed on there, to get over 300 responses to our survey to understand the communication challenges and barriers that might be experienced when you're accessing a healthcare service. That's been great for the Trust because they've been able to embed that, but actually it's been really useful for us in this COVID-19 period where digital technology and those solutions have been massively accelerated in terms of delivery of healthcare. So we've been able to provide the report to a number of different organisations who've been able to make use of it. So to go on to the Calderdale COVID stuff that we've been working on with Health Watch, I've put down there a list of 5 things, and I can almost say that they've been delivered in chronological order, apart from supporting staff and volunteers, which is obviously something that we needed to do all the way through the pandemic. We saw our first job as being about providing up-to-date information for the public, and we've got a frequently asked questions section on our website about access to health and care services. We asked staff to get involved with the kind of community and voluntary sector support if they lived locally. And one of the things we were able to do, because NHS complaints were completely paused during the pandemic, was we were able to offer some emotional support to people who were in the process of making a complaint. So offer a befriending type service that worked really well and brought in a lot of intelligence. And then the working with the seldom heard and influencing health and care delivery is best explained under the piece of engagement work that we've been doing. So we've been, we launched a project at the end of May that was developed in partnership with a range of organisations across Calderdale to ask people about their experience of health and care during the pandemic. So Calderdale CCG supports an engagement network, and it was all the partners involved in that network who refined and developed the project plan and the survey. And so we launched the survey. We've had, it says there, 377 responses to that survey, but obviously there's more feedback that's come through with the channels. We have we launched some storytelling tools because we realised that people might not want to sit and fill in a survey. They might want to do something a bit more diverse. So we had stuff like sending a postcard to yourself in the future. And we worked with some young people through Snapchat to create a playlist that is again on our YouTube channel of songs that they found were really significant to them during the COVID-19 period, which felt like a really positive and different way of working with people. And we've been pulling together some information and signposting summaries from the stuff that people have been contacting us about. So there's 4 key themes I would say that have come out of doing that piece of engagement. 2 of those are about access, one about communication, one about quality of care. So when it comes to access to services, I think we've probably got 3 cohorts of people. So we've got a cohort of people who are quite content to access a service in a range of different ways, including telephone and online, and they feel confident and capable about doing that. Then there's a cohort of people who perhaps might feel quite comfortable doing it themselves, but have real concerns about doing it for about family members being able to access care in a different way. And then there's a group of people who've responded to us who have said, I want to be able to see somebody face to face. That's how I like to experience my interaction with health and care. There's been some concerns raised in the digital stuff about the fact that if you need to register online for the first time, that can be really complicated and difficult to understand. There's been some stuff raised with us about long telephone messages. If you ring your GP surgery, you're sort of stuck listening to a 5-minute message trying to make sense of everything. So we've had some feedback about those kind of elements of access. But the thing we've received perhaps most negative feedback about was communication between staff and patients. And I think that's because people felt like they didn't understand what they should be able to get. So a lot of people told us that they just wanted to be able to speak to a person to get some reassurance. If you normally have a diabetes review that's been postponed for 5 months, you might want to talk to an actual person about that rather than just receiving a letter saying that it's going to be pushed on. So there was a lot that was about wanting to be able to have that conversation and get that reassurance from a person. But conversely, we got a lot of positive feedback about quality of care. So people talked about once they got through that door, once they'd started to speak to somebody, having a really good experience, which is fab. And a lot of that was about person-centred care. A lot of people talked about the breakdown of barriers between different health and care services and how that had enabled them to have a better experience with their care. You'll be able to see on there, there's also 2 sections, one specifically about mental health, because there's been a lot of reports about the impact on people's mental health, both good and bad through the pandemic. And there's some specific details in there about different groups with different demographics and how that might have impacted their experience. And I can give you more information about it if you'd like to, but we've been able to do that because we're using a new piece of software. Unfortunately, the report has been finalised and gone onto the website today, so anybody can go and download it, but I'll send the link on to Carol so that she can share it with you guys. In terms of the Calderdale Involving People strategy, One of the groups that's listed there is the group that came together to kind of design the piece of COVID engagement. And I've been doing I've got a specific task and finish group that I chair that's been doing some mapping of all the engagement pieces of work that have taken place across Calderdale at this time. There is a comprehensive list that I have of 23 different pieces of engagement that have taken place, which is fantastic because it means that we're capturing people's voices. And now there's a piece of work for that task and finish group to do to try to pull the learning from that together so that we can use that to influence. So to talk about the things that I think Healthwatch and Scrutiny could work on together, I think we've got some good ongoing work around adult autism, child and adolescent mental health. I think we've talked about dentistry before. If I was to start talking about dentistry now, I think we'd be here till the end of time because I've got so much to say about it. But of course, access to dentistry has become an even more acute issue during the COVID-19 pandemic. And I think there's something for us to pick up around that. And I think there's potentially a piece of work for us in looking at the presence of public voice in organisational reset plans. But I'll stop sharing my screen now and I'm ready to take questions.
Helen, I'm amazed. Thank you for that. That's absolutely concise and brilliant. So well done on that one. I didn't think you got to rise to the challenge, but you did. So I'm extremely well impressed and very much appreciate both the presentation and the detailed information. So we're going to questions. So Councillor, just get my list. Councillor Stephen Lee, please.
Thank you, Chair, and thank you, Helen, for that. Now, I've got one particular thing I want to ask about. You mentioned it right at the end. That's not to denigrate in any way all of the whole gamut of things that you're dealing with. But this is an issue that was brought to the scrutiny panel a few months ago and by Councillor Greenwood. And I think it's so important. It's about children's dentistry.
Yes.
And because of COVID, we know nationally, it's been widely reported that this is a problem. But I think that the members of this panel thought last time, the thought of children suffering from dental problems and, suffering is it's almost unbearable. And, Megan mentioned her grandchildren. I indeed can, mention my grandchildren. The thought of children having pain with dental problems is just horrible. So would you please somehow use your influence and lobbying capability or whatever it is that you can do to report on this with absolute urgency, because here we are in 2020. We cannot have this for a moment longer. Thank you, Helen.
Thank you, Helen. Would you like to come back on that? Are you okay to do that? Yeah.
That's okay. Just to give you some assurance about that. So we did a piece of work in June where I pulled together all the feedback from Healthwatch across Yorkshire and the Humber about their experience with dental access during this period of time. And we submitted that to a parliamentary select committee who have been considering that. We're working with Healthwatch England because finally, it's now seen as a national issue, not just a West Yorkshire or Yorkshire and Humber issue, which means that we're able to have a little bit more influence. But I'm involved in conversations about that on an ongoing basis because it's absolutely critical that people are able to get access to the dental care that they need. And with less routine care being available at this point, actually you might expect to see something like children's dental health declining because they're not able to get some of those routine checkups. So I think it's a really important issue.
Yeah, thank you for that, and thank you for the response. Councillor Hutchinson, please.
Yeah, thank you, Chair. Can I take you back to the outpatient transformation work that you've done? Am I right that the 311 odd people that you spoke to were answering in a theoretical way? It was what they thought, barriers they thought they might come across in outpatient consultations remotely. Is there anything going on to try and interview people who have had the remote consultations and find out what their real lived experience, whether they were people from disadvantaged groups or just part of the general public, and whether it's possible to do that work and find out whether what's going on at the moment is actually working in practice.
So it's something that I would need to speak specifically to my colleague who's closer to it than I am about. We're still involved in the Outpatient Transformation Plan Project Board, and we're there as kind of like an engagement partner, and as with our expertise. I know that they've been looking at people's experience of actually going through this process, but I don't know where they're at with it, whether that's been like a small sample of people, whether they're planning something that's much bigger, but I can come back to you with details on that.
Excellent, thanks. Thank you for that. Right, I'm just looking down my list. Councillor Greenwood, you just making a point, perhaps Debs can respond via the chat group about whether you should be isolating. So we'll go to Councillor Barnes, please.
Thank you, Chair. I think Health Watch do some great work, and I think I've seen positive contributions whenever Health Watch have appeared in front of this committee. I think I'd like to turn it slightly around and say, how can we help promote the work that you're doing to get to a wider public audience? And I think really it's a question of that I would like to ask.
I'll let you come back in a moment, Helen, because I think actually the whole idea is involving you on a more regular basis, and equally we're just discussing earlier, actually Zoom meetings are brilliant because actually you can be wherever you want to be, and actually one of the bigger invites was to invite you to a number of additional scrutiny board meetings on a regular basis, so you can actually be there as almost a critical friend, but actually come in with various points, like you raised an extremely important question earlier on. So I think it's really valuable that actually you are recognised as an organisation that we want to work together to provide better outcomes for the general people. So I'll let you come in if you want to add anything to that.
Not particularly, I was going to say, we really welcome that. We're really keen to work with you and make sure that if we have some understanding and knowledge from the public, that you're able to access that and see that. What I am thinking about is, I think it's probably quite a while since I did a kind of councillor-wide sort of contact. And because we've now got the COVID-19 report that's kind of really current, really live feedback, I think I'm going to email out that contact to all councillors, because it is really helpful to have you as advocates for Health Watch as well, and encouraging people if they want to share their story, or if we're doing a particular piece of work, to be kind of connecting people in with that if you know about it. So I'd welcome any support from you with that sort of thing.
Yeah, fantastic. And we've had some really wonderful outcomes by working together. Certainly the wheelchair was the wheelchair access was one of the greatest things actually. It was brought from I think working with Councillor Whitaker and other people as well. I think it was a really partnership working together to achieve better outcomes. So it's absolutely superb on that. I don't think there are any more questions. Has anyone indicated any more questions? Put your hand up now if you're not. I would very much thank you, Helen, for attending. As always, as I say, we want to work together moving forward, and you and the invite, we'll make sure you're on the list to invite you on a regular basis. You're more than welcome to stay, and if you've got better things to do, then by all means. We've got a few things that we will be picking up on the work programme, including mental health, and the next item really, it really is working in conjunction with the next item as well, really. So let's go on to item number 7.
Thank you.
So yeah, no, thank you. So the voluntary and community sector during COVID. So Sean, welcome Sean, and welcome. I've lost the other person. So yeah, Sean, would you like to introduce?
Thank you, Chair.
Yeah, we've had the report, but if you'd like to add to the report, please, or anything additional you want to highlight, please.
Yeah, thank you very much, Chair. I've also invited the guest speaker, Carol, who's the Chief Exec of Voluntary Action Calderdale, which is part of the Alliance, the Voluntary Sector Infrastructure Alliance, along with ourselves and the Clinical Commissioning Group, as a kind of an innovative partnership supporting the sector in Calderdale. And it's really nice to have just been here to see Helen from Health Watch do her report. Obviously, as part of the sector in Calderdale, a really vital part of the sector in Calderdale. and have been part of the response to COVID. So I'm not going to spend a lot of time. I know it's a late meeting. People have been here a long time already, hearing a lot about what's going on with COVID and discussing all aspects of that. But I was just going to very quickly introduce this report, which I know you've seen. It is quite long, but hopefully you've had a chance to read it. It's got pictures in, hopefully to make it a little bit more engaging and interesting to read through. And just to say, we've also taken this report to Place Scrutiny last week. And I know some members were also at that panel meeting. And I've just realised, I'm really sorry I didn't introduce myself. I do know pretty much everybody who's here because I've been around at Calderdale for a while, but just to properly introduce myself, I am Sian Rogers. My job title is Policy and Projects Manager. I do a number of things, but I'm also the lead for the voluntary sector for Calderdale. And some of the things that I do is I look after the voluntary sector infrastructure contract on behalf of ourselves and the CCG, but I also look after the Health Watch contract. So yeah, so lovely to see Helen doing that great presentation. Yeah. So I put a very brief summary note on the front of the report, which just summarises that obviously COVID has been huge. It's impacted everybody in Calderdale, and I'm sure many of you as individuals have been involved in some of the voluntary and volunteering effort in Calderdale. It's touched most people and in lots of different ways. This report could only ever have been a snapshot of what's gone on. We've done our best at trying to pull together a kind of a fairly rounded view of what's happened, but we know there's many organisations that we haven't managed to cover or include in this. But like we said at the beginning of the report, we really want to thank everybody who has been involved and has made a contribution by either volunteering, helping a neighbour, or as a more formal organisation delivering services and changing services. We've tried to organise it in a way that is easy to follow around four kind of key, I think it's, four themes. So the kind of formal and informal mutual aid works, stuff that's been happening, the volunteering hub that my team has coordinated on behalf of the council, the voluntary and community sector response more generally, so organisations who've changed and flexed and done all sorts of amazing things. And particularly the stuff around food poverty, which has been a huge piece of work, organising the kind of food deliveries for people. And then that kind of collaborative work that I think we've really shown is a real strength in Calderdale, working with the Alliance, but working with all of our partners. I'm not going to say a lot more, apart from one brief little bit about the volunteering hub, which we've managed and run on behalf of the council. It was a rocky start. I mean, it was a very, and Councillor Scott Patient, who's the portfolio holder for the voluntary sector, and he was here at the Place meeting. He mentioned that I think the moving from floods into COVID and COVID response was such a difficult thing, both for ourselves, managing that volunteer response, but also for people, obviously stepping forward and demonstrating that kind of community spirit. But what was incredible was that we did manage to get that up and moving and running. We've had a kind of an average of about 840 plus individuals who we've been looking after and supporting through the volunteer hub. Some people have been much more active and involved than others. We know there are some people who, for all sorts of reasons, we haven't been able to utilise every single volunteer who's offered to help, but we are continuing to communicate and liaise and link and send messages to those people. And it's been a great way of kind of getting, we've been doing safeguarding training with those people. We've so a huge, I think 40 of the people on the volunteers who volunteered originally are now formally befrienders working with our Staying Well scheme. So it's been a real way for us to develop that volunteering kind of capacity and offer from local people. So that's something that I'm proud that we did as a council, but I think I'm going to introduce Topeka to talk. I was just going to, obviously from Voluntary Action Calderdale, and talk a bit about maybe a particular example around health, because we felt that was important to pick out as an example or a case study for this panel.
Yeah. First of all, before you bring in Topeka, welcome Topeka, by the way. But Sean, just a word of thanks from the panel for all the help that you've done so far from January this year. It's been quite a year, actually. I've forgotten. People forget about the floods now, but actually it's been an absolute massive thing. I think actually what's going to come out of this is actually people caring for Mrs. Jones down the Rose, Mr. Smith up the Rose, and caring for the communities a bit more. So welcome to Topeka. I'm really pleased that you could attend. It's nice to see you face to face. So would you like to add something to your report?
Thank you, Councillor, and thank you for inviting me here this evening. I don't want to say too much over and above what Sean said. I think she summarised that really, really nicely. I just think it was really important from a VSI angle to tell the story in Calderdale about the voluntary sector and the community response, and to make sure that we were able to be visual about that. So in terms of the voluntary sector and the role it's played, it's from a health angle, there is evidence it's played a really critical role, which has stopped many individuals going into crisis, and I think that's really important. And some of the really vivid kind of examples are from or through Healthy Minds providing the 7-night-a-week safe space service. We've got the Brunswick Centre, who have provided some really critical help and support to some very vulnerable, unwell individuals, making sure that they didn't relapse from the current treatment programmes. And obviously organisations like the Women's Centre, who's provided some really critical support to families, but also individuals who are at risk, particularly during lockdown. So I think in terms of that kind of very critical, that very clear role in reducing what could have been quite a peak in terms of crisis, has not necessarily been averted, but certainly reduced due to the sheer speed and the way in which the sector has responded. And I think I'd also like to note that generally the feedback is that people have felt supported, they have felt that they could be signposted to support, and I think the volunteering hub has played a really critical role in ensuring that we can match need to what has been a really, really huge response to supporting people within their neighbourhoods. Just a couple more things I just wanted to kind of to note is that I think partnerships such as the Voluntary Sector Infrastructure Alliance and the wider partnerships with Community Foundation for Calderdale and public sector partners, again, can't be understated. There was a very quick response around patient transport for non-COVID patients, but those who really needed that critical face-to-face support from their GP. So again, working with the voluntary sector and the public sector, that solution was effectively within days that was set up, and that supported I think over 200 people during the lockdown. And I just wanted to end by saying that the demand is going up, the demand spiked, and it continues to rise. And as a sector, I think nationally as well as locally, there are risks and there are challenges, as there are for all of us. And I'm particularly looking forward to working with our public sector partners through the Alliance and with wider partners to make sure that we can continue to harness and work together to tackle this. There is a second survey now that's being carried out, so we continue that trend and trajectory to understand what's going on with the sector, and I'm hoping at some point we can share those findings with you. Thank you.
No, thank you very much for those comments. I'm going to bring Councillor Barnes in at this stage, please.
Thank you, Chair. I think books for young children, reports for councillors, more pictures the better. I think is a good start. I think I hear and thank you very much for the honesty of the difficulty you experienced in that early phase of moving from flood into COVID, and thank you for that honesty. I think going forward, I'm not sure whether we're at the end of the first wave, the spike in the second wave, or wherever we are in the position, but I think as Councillor Hutchinson is always keen to tell us, this is a marathon COVID and not a sprint. How prepared are you for what could be, if winter does turn bad, how prepared are you in regards to continuing and back upscaling the work at that stage?
Sean, would you like to come back in on that? Or yeah.
Yes, sorry. I was just struggling to hear a bit. I've got a kind of background noise in my house with boilers and things going on. But yes, I think that's a very good question. I think we are continuing to meet through I think you will be familiar with the silver sort of structures that we have to managing the response to COVID. there is a group that's called Silver Communities, which is very much focused on the community response and how we continue that. And a number of people and partners are around the table actually involved in that, including Helen Hunter from Healthwatch and Jane Leach, who's the Voluntary Sector Infrastructure Delivery Manager, who's works with Topeka very closely. We aren't specifically at the moment surveying all of our volunteers to ask what their current status is and if they're still able to help. And I think, because that's a very fair question, one of our concerns that people would be going back to their normal lives, they may not be able to help as much. So we are, that's something that we're ongoing with at the moment, so that we are in a position where if we need to kind of, because at the moment we're down to about 4 or 5 referrals a week. At the peak, it was probably tens a day. And overall, I think it's in the report, there's something like over 1,000 people that have been supported through that process. So it's much lower now. And we have kind of rolled back the staffing that's gone into supporting that process, but we are in a position where we should be able to mobilise that back quite quickly. Longer term, we're also looking at how we could work more closely with the Voluntary Sector Infrastructure Alliance and developing more capacity in the voluntary sector to help manage that process within the sector rather than using council staff. So we are really thinking about the future with that and longer term resilience.
Yeah, super. Thank you for that. Helen's acknowledged the voluntary sector and the communities have really stepped up. So I just wanted to point that out. She's done a chat. We won't read it out, otherwise we'll delay the meeting further. But thank you, Helen, for your input, and thank you, Sean and Topeka. I think some of the items actually you've mentioned within the report. It's things that we're hoping to pick up on the work programme. For instance, mental health. Alcohol and drug issues that will be rising as we move out of or as we continue as we are doing at the moment. So items that we are conscious that we want to work together with Healthwatch to actually work all together as a community to likewise to improve and promote the community of Calderdale. So very much. Like to thank you for your question. Councillor Clark, you've raised a question as well. Sorry, I do apologise. Wherever you are, can't find you.
Hi, I'm here.
Oh, you're there. Sorry, yeah.
Hi. I don't know whether Sean's already answered this. Actually, it was about the 840 volunteers. Do we know the proportion of those who were people who were furloughed maybe and felt that they needed something to do? How many will be going back to work? How are we going to keep that up? Sort of over winter when people are working, that level of volunteer.
Yeah. Thank you. Yeah, Councillor Clark. We don't know whether or not people were what their own personal situations were. But like I said, that is something that we're in the process of checking.
So you're actually checking that.
Yeah.
Oh, thank you.
Superb. So there will be outcomes coming from this, but will be incorporated into the work programme, and we're very much welcome working together. Moving forward with anybody basically, but actually certainly your inputs, Helen, Sean, and Topeka is extremely valuable, and we will ensure that we do contact you as and when we do the session reviews. So that leads on to item number 8. I've lost my here we go, which is the work programme. So just to let you know, at the last full council meeting, it was decided that we would do a review of the COVID situation in Scrutiny in a day. I'm going to ask Alex to come in on basically what that will involve, please.
Yeah, so thank you, Chair. So I'm wondering if I'm perhaps better handed over to Mike at this point for some of the more particular details about plans for the COVID review, perhaps, if that's okay.
Sure. Yeah, no, of course it is, Mike. Yeah, welcome, Mike.
Okay, thank you, Chair. I think the reason for this arose from discussion at council, not necessarily a decision at council. I'm not sure about that, but Councillor Swift, the leader of the council, via Robin, contacted Councillor Blackburn to talk about having a more detailed look at a stock take, if you like, of the current position on COVID, and also looking forward, I suppose, initially for the winter, the 6 months from now, or from October, but perhaps longer as well. And Councillor Blagborough has agreed that and discussed that with myself and Councillor Megan Swift and Alex. So we're trying to put together a programme which would be a sort of a longer session than you normally have, a 4-hour session, with some themed discussions at the beginning, and this is following discussions with Councillor Blackburn and Councillor Megan Swift and with Robin. So rather than having each agency coming in turn and talking about their own response, talking about some themed issues, which the current proposal, which we're working on, it isn't finalised by any stretch of the imagination, would include the acute hospital response, would include some stuff about social care and primary care and community health services. Robin thinks it's very important that we talk about the PPE, the protective equipment position, both what's been done in terms of the stock take to get to the position we're at, but also to assure you or otherwise about the position going forward. And then spending the second part of the meeting for you as a group, as a group of scrutiny members, to decide what you feel comfortable with, what you feel assured by, and what you'd like to recommend back to either Cabinet or the CCG or partner agencies, CHFT, wherever you thought what you would like to see being addressed in the future. And my recommendation to you would be, like other bits of pieces of work that other scrutiny boards have done in a day or half a day, that some of you I think have been involved in one way or another, would be that we produce a short report, a short punchy report that you would agree would be your report and would then be fed in, my view would be publicly to the Health and Wellbeing Board, but also to other structures as well. 4 hours might seem like quite a long time, but if you take 4 or 5 themes and then have a proper discussion, it's not a very long time. So one of the suggestions that I've discussed with Councillor Blagborough is that once the programme has been decided, we ask members if they can to submit questions and points in advance. That means that people who are coming, and we are hoping, well, we will get people from the CCG, CHFT, the Mental Health Trust, and we haven't asked people yet, but we'll be, I don't know if Topeka's still here, but we'll be asking the voluntary sector as well, so that they can tailor their contributions to the things that you think are important and you want them to address. That doesn't mean there won't be an opportunity for questions and discussion in the meeting, but it will help us get through what is in fact a very tight agenda. Thank you, Chair.
Yeah, that's really well covered. We've probably missed a few different details out, but we'll be circulating as soon as we've put the full programme together. We'll be circulating that to members, and part of the review may well be actually some recommendations to other scrutiny panels for them to investigate other avenues where we don't think it's appropriate for adults, but equally it could be for places or even children and young people. So, Councillor Hutchinson, you wanted to come in at this stage?
Thank you, Chair. Am I right in assuming that the secondary care aspect of it won't just concentrate on coronavirus response and acute care, but on how the service will try and get back the ground that's been lost over that time, building back the services?
Yeah, absolutely. That's certainly a great input. So yeah, that's something that will be included. And equally, once we've circulated the recommendations of the scrutiny day, as always, my door is always open. You know, if you feel you want to add something additional to that, please feel free to contact one of us, because we want it to be a really useful document at the end of this, and something that we can take away and actually, this is what we've achieved, throughout this period. So I think that's really important. So I think the work programme, because of that, we're hoping to set a date in October. So what we're going to be doing is probably not having the general scrutiny meeting, but we will replace that with scrutiny in a day to cover this particular topic. So we've just got to come up with a date where we've got the key people that we want to obtain their views and question, and then we'll circulate as soon as possible so members have that in advance to put in their diaries. So just to let you know on that. Yeah, Mike. Yeah.
I think Councillor Swift wanted to come in first.
Oh,
Yeah,
can I?
yeah. Yeah.
Very, very quick one about this meeting that we're having. I misunderstood, I think. I didn't think it was just for our scrutiny. I thought we were opening it up because of the questions from people not on this scrutiny. Have I got that wrong?
Let's. I'll come back to you on that one, Megan. I'm sorry, Councillor Swift. It was discussed, and my recollection now has gone out the window. But I think we'd welcome. I think we've got to keep it very focused. This is the key thing. I think. Whilst we can send the review out to other members for important questions, what I'm really keen on is actually this board is very focused, and we actually have the opportunity as the scrutiny board to raise those questions. That's not to say we don't welcome comments or questions from other members, I think.
Okay.
Is that good, Mike?
I mean, there was one thing I forgot to mention, Chair, and that was that what we're suggesting is that we limit this to health and care, again, because we've only got 4 hours. So issues about, for example, the economy and the impact on people's jobs and work will be dealt with by Place Scrutiny Board.
Yeah, exactly. Yeah, that's what I was suggesting. Actually, some of the recommendations would be actually that this is picked up, the economy part, and everything else is picked up. So I think that probably covers that particular item. I think the other items is a joint scrutiny panel of the Calderdale and Huddersfield Hospital next Friday. So we'll at the following meeting we'll be able to provide you with an update of that. Is there anything else to add, Mike?
Just that the West Yorkshire Joint Health Scrutiny Committee meets on the 30th of September.
Indeed. So just for your information, we'll be circulating the work programme with the revised, as some of the revised issues, and we're constantly working on in the background. So I don't welcome anyone's input on that. But I think that covers all the items I can see on the agenda. So wow. Well done, members. We've done extremely well there, and we've been very, very focused. So thank you for being focused. Thank you for Carol for your technical abilities to get us online. So well done, Carol. You did a marvellous job. We'll put you in charge of the IT department one day. So super.
I should thank IT as well, but thank you.
Yeah, no, absolutely, no, indeed. And thank you, members, and thank you for partaking in this really important scrutiny panel. And have a nice evening and nice weekend. So thank you.